Welcome to this edition of the First Aid Show. Managing breathing problems can be difficult for a first aider to identify and treat. In this film, we asked a paramedic on the best ways of identifying and treating a patient with a breathing problem.
If you are with somebody that is complaining of breathing difficulties, there are a number of things that you can look for, clues to see how serious the situation is. So one of the first things are they able to speak to you in full sentences? If they can't, if they can just say yes or no, or they can't speak properly because they're so breathless, these are the sort of details that you need to communicate to the person on the end of the 999 call. If you notice that their lips are turning blue, their hands are turning blue, or they have really discolored face, that is another thing that you should report because it shows that this is a much more urgent situation. In terms of supporting the person themselves, we would encourage you to get them in an upright position. So if they're laying flat in bed, push them up, put lots of pillows and cushions behind them so they're in an upright position, which makes it easier to breathe. Stay with them, talk to them calmly, reassure them that help is on its way. And if they have any sort of medication or inhalers that they can take, encourage them to take their own inhalers that can help open up their airways. If it's a breathing difficulty emergency, you will get help really quickly, as long as you give clear information down the phone to the call taker.